Good afternoon. Today is June 12th, and today I'll continue to be talking about the coronavirus. So the first piece of news that I'd like to talk about is Peru. When the coronavirus first came, President Martin Vizcarra of Peru followed the best advice. He ordered one of Latin America's first and strictest lockdowns and rolled out one of the region's biggest economic aid packages to help citizens stay home. He shared detailed health data with the public, rushed to add hospital beds and ventilators, and increased testing. Yet, right now, Peru has become one of the world's largest hotspots, with about 6,000 confirmed COVID-19 deaths and more than 200,000 infections, and experts say those numbers understate the true extent of the pandemic. Because of poverty, many in Peru have been forced to continue working. 1 in 3 Peruvians lacks access to running water, and only half of Peruvian homes have refrigerators, forcing many families to return daily to crowded markets. Right now, I think this is what is happening here, is that many people could not stay home as a lot of people have no savings, and since few people had running water, it was impossible to wash their hands, and I think return daily to crowded markets is just a major source of contagion that many people are catching right now. Peru's tragedy is unfolding amid a broader explosion of the virus in Latin America, which has turned from a haven to an epicenter of the pandemic over the past 2 months. About 1.5 million people in Latin America have tested positive, so Peru right now is just a symbol of what is happening. Peru had years of strong economic growth fueled by mining and agriculture exports, as well as prudent financial policies, but the lockdown has exposed the fragility of Peru's economic process. 2 decades of economic growth lifted many incomes, but brought few stable jobs and little healthcare investment, reducing the effectiveness as President Vizcarra's pandemic measures. Now, many Peruvians find themselves in the same situation, being forced to risk catching the coronavirus rather than stay at home and slide into poverty and hunger. So I think this is just a symbol of poverty and how Peru had just failed its coronavirus response due to these factors. The second thing that I like to talk about is that there have been a mutation which has found that that may be the reason why one variation of the coronavirus became dominant in many parts of the world, particularly in Europe and in much of the United States. Scientists have shown, at least in a tightly controlled environment of a laboratory cell culture, that viruses with that mutation infect more cells than those without the mutation. The virus found at the beginning of the pandemic in Wuhan, China, did not have the mutation. The researchers at Scripps Research, based in Florida, found that the mutation known as D614G stabilized the virus's spike proteins, and which attach to cells to infect them. The number of functional and intact spikes on each viral particle was about 5 times higher because of the mutation, increasing the likelihood of infection. So, as a result, perhaps the virus spikes with the mutation were nearly 10 times more infectious in the cell culture system that we used than those without. And this may be the reason why the virus has been spreading so quickly and vastly in areas such as the United States and Europe, and this mutation may be the key to solve it all. However, other scientists have also cautioned that it would take significantly more research to determine if differences in the virus were a factor in shaping the course of the outbreak. Other factors clearly played a role in the spread, including the timing of lockdowns, travel patterns, and luck, which other scientists are arguing. While this new study has not been peer-reviewed, it does show that the mutation appears to change the biological function of the virus using the spike protein, as I said. And I think as viruses mutate at a much faster rate than bacteria and other pathogens, this may be the reason why the US and Europe are suffering so much harder than countries that do not have the mutation. That's it. Thank you for listening, and I hope you have a good day. Thank you.